Thank you so much for coming. We're gathered here to share some very critical information about the Eastern equine encephalitis virus. Last Friday, our State Department of Public Health announced that a second Connecticut resident had tested positive for EEE, and that the first person who tested positive had died earlier last week. Today, it has been confirmed that the second person who tested positive for EEE has died. Both people were older adults. One was from East Lyme and the other from Old Lyme. This is a serious public health concern, and we wanted to let you know that these are the first deaths from EEE that have been reported here in our state since 2013. We also know that this is an effect of climate change, and it's not just happening here in Connecticut. This virus has been found in Massachusetts and Rhode Island, where multiple people have tested positive. There have been 2 fatalities in Massachusetts and 1 in Rhode Island. People across our state are obviously concerned about this, as are we, and that's why we're here. But the most important thing that we want people to know is that they shouldn't panic, because there are precautions that can be taken right now to reduce people's chances of being affected. And these steps include using insect repellent, wearing protective clothing, especially at dusk and the early evening, and limiting time outside in the early evening. Now, I am joined by our state experts, and we have with us today our leaders of the Department of Public Health, of DEP, the Connecticut Agricultural Experiment Station and the Department of Agriculture, and also our Department of Transportation. We're going to be hearing from each of them in a minute, and the other thing we want to let you know is by the end of the day, we will have up on the State of Connecticut website special information about how individuals and families can protect themselves and where municipalities can find more information about protecting their residents. So we are going to start with the leader of our Department of Public Health, Commissioner Renee Coleman-Mitchell. Commissioner.
Thank you. Good afternoon, everyone. As it's been stated, we are here to report the second human case of the Eastern equine encephalitis virus. I have more of a personal story to share about this, and that is one in which this morning I received an email from a family member of a person who passed away from the second death, who passed away from EEE. And it was very, very sad to read the email, and at the same time, the family felt very compelled that we as a department and as a state really share this information in terms of the precautions that can be taken, because they felt that they were so close to this family member that the messaging needs to get out. So we keep repeating the same thing over and over, but it's something that needs to be really something that we know this rolling off of our minds. One is using repellent, covering bare skin, and to be decreasing the amount of time that we are outside, starting from an hour before dusk and between dusk and dawn. I want to also say that we have been working very closely with all the partners that are listed here beside us right now, but also local health and our local policymakers as well. Now I want to take a brief moment to introduce our state epidemiologist, Dr. Matthew Carter.
I talked to many of you on Friday afternoon about the second case and the first case as well. And these are the first 2 deaths involving Connecticut residents since 2013, but I'd like to point out that we've known about EEE virus in Connecticut since 1938, and there were no human cases between that time and 2013. So this is something different. And certainly what we're experiencing this year is different. We're seeing activity not only in New England, but in New Jersey and along the Atlantic coast as well. But in Connecticut, we haven't seen anything like this since 1996, when there was extraordinarily high virus activity in Massachusetts and Rhode Island and in the southeastern part of Connecticut. That led to ground spraying from the backs of trucks and also aerial spraying when EEE virus was found in what's called a salt marsh mosquito. For those of you who live along the coast, you know that salt marsh mosquitoes are voracious human feeders, to quote Dr. Andreadis, who's about to talk. And that triggered off aerial spraying. But those events occurred earlier in time than where we are right now on September 24th. And in both of the human cases that we've been talking about, these were folks who became ill in the last week of August and the second week of September, which meant that they were probably bitten by a mosquito that was infected with the EEE virus sometime in the last week of August, first week of September. And so we're not now dealing with the same situation as that. And Dr. Andreadis from the Agricultural Experiments Station will describe that mosquito numbers in Connecticut are dropping quickly now that we're towards the end of September. The other finding that has led to a lot of phone calls in my office today is it was announced yesterday that there was a positive mosquito test from a trap in South Windsor. And this was a part of the state that had not previously seen Eastern equine encephalitis virus. This was a kind of mosquito that you find in salt marshes, in white cedar swamps, which is where this is. It's so important to point out that Eastern equine encephalitis is not the same as West Nile virus. And we've been dealing with West Nile virus every year for 20 years. And it occurs in urban and suburban areas, in storm sewers, and standing water in your backyard. That's not what we're talking about this year. We're talking about something that happens in swamps and wetlands, mostly found in the eastern part of the state. And by and large, this has remained largely focused on that part of the state. And we really are not talking about west of the Connecticut River at this point in time. We're really focused on east of the Connecticut River and the increasing activity. So in South Windsor, for example, because they have a trap and because this has been found, we're recommending that people take precautions to prevent mosquito bites and also to minimize time spent outdoors. And if being outdoors is unavoidable, people should take all the precautions they can. So clearly, South Windsor doesn't exist in isolation. There are towns around South Windsor. Sports teams, for example, we've gotten calls from schools that says, my school plays the school in South Windsor, what should we do? Really, in this case, many of the towns where this has already happened, they've already changed activities. They've already changed outdoor practices, sports activities, times of games, etc. And this is something that needs to happen in South Windsor as well, and should be considered by surrounding towns, because the Agricultural Experiment Station does not have the resources to put a trap in every town. But as will be mentioned a little bit later, we're almost at the end of this. The first hard frost is not nearly as far away as it was a month ago. Thank you.
Thank you so much, Dr. Carter. And before I introduce our Dr. Theodore Andreadis, I do want to point out that we are joined by our Agriculture Commissioner, Brian Hurlbert, and also our state veterinarian, Dr. Mary Liss. So thank you so much for joining us, and I'd like to invite the leader of the Agricultural Experiment Station, Dr. Theodore Andreadis, to the podium, and I think you will be very reassured when you look at his graphs and charts.
Okay, thank you. I'd like to give you a quick update on what we're seeing with our mosquito testing and trapping program. Just as a little background, We run a comprehensive program where we trap mosquitoes from the beginning of June until the end of October at 92 locations throughout the state of Connecticut. And we get literally thousands of mosquitoes that come into our laboratory on a daily basis. We screen them for West Nile virus and, of course, Eastern equine encephalitis. Now, right now, we see that the greatest risk really is east of the Connecticut River. However, we do have some very good news. As we've been monitoring our mosquito populations, we're seeing that the number of mosquitoes are declining very rapidly. And this is a map that hopefully you can see showing our trap collections dating back to the beginning of June, and you can see here we are now where the mosquito numbers are clearly declining. The other good news is that the number of positive mosquitoes that we are finding with Eastern equine encephalitis have also declined dramatically, and this is very, very good news. You can see that they peaked really around mid to late August, and now here we are in the second week in September, and they're continuing to decline. Now, that being said, we still have mosquitoes out there, and we still have a few that are infected with this virus. Now, the risk is greatly reduced than what it was several weeks ago. However, I reiterate what other folks have said here, there still is somewhat of a risk, so that people should continue to take the precautions to avoid mosquitoes and curtail evening activities. As I indicated, this map here shows the distribution of where we have found infected mosquitoes in the state, where we have had the 5 equine cases, and where we have had the 2 human cases. Okay, and you can see that the majority of these are over in the eastern corner of the state. The area of greatest concern still continues to be the extreme southeastern corner of the state, Stonington, North Stonington, and Voluntown, and we are still finding a few infected mosquitoes in that area, but the majority of these are those that bite birds only and not humans. So we do have good news. And as has been stated, we really just need to get through the next couple of weeks and we will be okay. All right?
Thank you so much,
Sure.
Dr. Andrianis. We appreciate that. And now I'd like to bring to the podium our Commissioner of Environmental Protection and Energy, Katie Dyke.
Thank you, Lieutenant Governor. I'll just share just briefly, as you have heard, we have very terrific agency partners that DEEP has been consulting with on a weekly basis as we've been monitoring Tripoli and assessing the most prudent approaches that we should take. DEEP has a mosquito control program within our agency with a small number of staff who have deployed some ground level spraying, including at Patchogue State Forest in the month of August and in other locations. And importantly, our program has also, it provides technical assistance to municipalities and others who have reached out and are making decisions about spraying programs themselves. As you can see through this weekly interagency dialogue, we've been assessing the need for aerial spraying. At this time, with these numbers and the number of cases, we continue to believe that aerial spraying is not warranted or wouldn't be efficacious at this time. But we're pleased to, again, make these decisions not in a vacuum, but with the information that we have from our agency partners, and so that we can continue to keep people safe, and of course to find ways to help underscore the actions that families and individuals can take to protect themselves in their daily life in applying repellent, limiting their exposure outdoors. It's so important what we're doing today. That the most powerful step we can be providing is information for people to let them know what's happening and how they can keep themselves safe. And pleased to be part of this interagency effort to make sure we can do so. Thank you.
And because this is of great concern, we want to make sure that we are using all of the resources that we have in state government. And I'm pleased to introduce Commissioner Giletti, who will talk about how our state DOT will help us get the word out. Commissioner Giletti.
Thank you, Lieutenant Governor. And yes, Department of Transportation has been involved in all these discussions what we are looking to do is not only use our ability to get messages out there to our own citizens, but to the people that are riding our highways through our state as well, so that we make everybody aware of how serious this is, and we are tying in and coordinating all these messages, and both the governor and the lieutenant governor brought us all together for this, and it has been an interdepartmental cooperation. Thank you.
Now it's my pleasure to introduce our governor, Ned Lamont.
Well, with the second fatality recently reported, what we're trying to let you know is that we're being cautious. State government is being cautious on your behalf, and we're urging you to be careful. No need to panic. I think you see from the folks standing here with me that when it comes to the testing, when it comes to the information out there, be it on the website, be it off of state transportation, when it comes to deep and environmental, we're making sure that we're doing everything we can to give you confidence that we have your safety at heart. And you've heard the good advice coming forward. No need to greatly change your lifestyle. I think we have a good bead on this. You can always go to our website to get an update in terms of what's going on. If you don't need to, no need to be outside in and around dusk in the evening. If you have to be out there, better to be covered up and use bug spray. Just good common sense things. And I just hope this group here today gives you an idea of how your state government works, looking out for you, and making sure we're monitoring a problem before it becomes a real problem. Thank you, everybody.
Any questions?
I had a question. You mentioned climate. Is that, because most of the time this tripoli has been in other parts of the country, not so much here. Is it because if we're seeing warmer weather here? I mean, why is it moved from the Gulf here, and why are we seeing so much of this in the Northeast?
The short answer to that is we don't know. Our best case scenario is that we know this virus circulates year-round in Florida. And we know from previous studies that we have done looking at genetic characterization of the virus that Florida serves as the source of the virus. The virus is brought up into the Northeast and the New England area on migrating birds. And apparently what happened this year is that we had many infected birds that came into the entire Northeast region, and then the mosquito numbers were quite high. And one particular mosquito called Culicida melanura that develops in these freshwater hardwood swamps started feeding on the birds. And for whatever reason, it started amplifying to very, very high levels early in the season. And that's apparently what happened. And I would just reiterate that what we're experiencing this year really is remarkable. We have never seen this much activity at this high a level over such a wide geographic region. And so it is quite unusual. And as we look forward to next year, I would anticipate that, yes, we probably will see some activity, but it's not likely we'll see as much as we did this year. But that's the best case scenario in terms of how we understand how this thing took off this year.
Does the horse population play into this?
No, horses do not serve as a source of infection for other mosquitoes.
Can you give us any more information about the second victim, age? I know you said from older and from old Lyme, I believe. Is there any other information you can offer? Yeah.
For reasons of confidentiality, that's the only information that we will release. My expectation, as you know, the name of the person in East Lyme was public this weekend. My guess is that will happen in this case as well.
Commissioner Giletti, you said something about you're going to be notifying people. Are you talking about putting up like flashing signs or something on the highway?
Yes, that is what we're talking about. We want to try and get that message out as quickly as possible, not only for our own residents, but the people that are using the highway systems as well.
So what do they say? Just wear bug spray?
No, I think we are still resolving the, because there's a limited amount of message that you can get on there. So we're looking to see whether or not we can direct them to a website and to make them aware of it.
Would that be targeted in southeastern Connecticut, or would that be across the state?
At this point here, we're looking at targeting it across the state, so that way there we get the message out as quickly as possible. We may be able to reduce that as we learn a little bit more and know that it starts to drop off.
Use those existing signs we already have now that warn people about accidents and stuff like
Good to see that you're paying attention on these things. Well, thank you. But yes, that's what we would look to use because we know that it's effective. We know that people see it. And as, you know, my being drawn into this was because it is a very effective way to get the message out to our own residents and to other people traveling through.
Can I ask the beat commissioner, you mentioned, you know about the spraying, ground level spraying in Patchogue State Forest.
Yep.
You said there was others. Where were they others spraying?
We have a number of locations, including, actually, that relates to where we've placed warning signs and provided messages about how people can keep themselves safe. But I can follow up with you with the precise locations where we've done the spraying. But we did spray.
You have the spray.
We did ground level spraying in Patchogue twice in the month of, once in the month of August and once this month. I'm happy to follow up on that.
And why isn't the aerial spraying necessary? Because we're so close to the frost line?
That's right. So I think from the graphs that you've seen, we know that the number of positive mosquitoes are trailing off. As the cooler weather comes in, we expect that trend to accelerate. So as we balance using aerial spraying against the likely effectiveness of it, that's informed that decision going forward.
Do you have an update on the national infections? How many nationally? I heard last week was up to 41.
I do know that they're experiencing an outbreak in, I do know that they're experiencing an outbreak in Michigan as well, and maybe a few other states. I think I also saw something on Ohio. So this is, once again, quite remarkable to see it in that location as well as the Northeast.
How does this compare to 96 and then 2013?
Well, in 1996, it was highly focal, and it was really just in that southeastern corner, in that Bon Island, Stonington area, and it really didn't extend to any other locations. But I will state is that the state did not have a mosquito testing and trapping program in 1996. And our efforts on that occurred because of what we learned in Rhode Island. And as a result of that, funding was given to the experiment station to establish its first mosquito testing and trapping program in 1997. That was funding that was put in the governor's budget and approved by the legislature. Prior to that, there was no surveillance program at all in the state of Connecticut.
Can I ask Dr. Carter, the normal fatality rate for EEE, as I understand it, is about 33%. Yet 2 people have been tested positive for the virus in Connecticut this year, and both have died. Is this a worse version somehow?
Well, I don't think we have any evidence that this is a worse version. There have been deaths, the one in 2013, the 2 this year. As to why these particular persons died from their illness would be speculation on my part.
Have there been any other deaths other than 2013 and this year?
In Connecticut, no. There were no deaths, even though human cases and deaths have been reported in Massachusetts and Rhode Island for 3 decades. Our first death was in 2013. Not even in 1996, but as I Ted pointed out, we didn't have a mosquito trapping and testing program in 1996, so we actually don't know how far it extended.
There was 1 death in 2013, and now we're saying 2.
That's correct.
With West Nile virus, we know that you can be bitten and have the virus and not even realize it. Is it possible that there are other people in Connecticut who have been bitten and have mild forms of EEE or not?
It is possible. There have been studies that have shown that people can have antibodies to this particular virus, which means that they were exposed sometime in their lifetime, but they never developed the symptoms. But what we do know is that once people become ill with the symptoms of Eastern equine encephalitis, the fatality rate is about 30%, which is very different from West Nile virus, because people can have mild illnesses, not requiring even a doctor's visit, to being hospitalized with encephalitis, and only a very few people actually die from West Nile virus. The other thing about EEE is that even if people survive, about 50% of those who survive will have long-term neurologic damage. And children can be affected by EEE. It's really rare for children to get sick with West Nile virus.
And regarding West Nile, though, there's been 1 human case so far?
In Connecticut, there have been 2.
2.
2.
What are those?
East Lyme and Old Lyme.
No, I'm talking about West Nile.
West Nile, it's in western Connecticut.
And that
Right now, this is the best West Nile season we've had in 20 years. We only have one case, and it occurred within the past month. So last year we had the worst West Nile virus season. We had 26 cases. This year we have one. But it's a very different disease, very different mosquito, very different control measures in many ways than EEE.
26 last year.
Yes.
Thank you, everybody. Appreciate it.